Well, hi, church family. Pastor Dan here with Mike Chupp, who is CEO of the Christian Medical and Dental Associations. And Mike, I'm sure this has been a busy and crazy time for you. You're kind of new to the role anyway, because we saw you in church, I think, about a year ago now. And you were just, I think at that time, about to step into the full-on leadership role that you have today. So tell us how that's gone this year and now how all this craziness has impacted you.
Well, thanks, Pastor Jarvis. I'm grateful for this opportunity. It is coming up right at a year since I was commissioned to be the new Chief Executive Officer of CMDA. I keep pinching myself. It's been an incredible year, a year of wondering what God was going to do, and up through the end of February, I was thinking that the year I was being blessed by an incredible amount of planning and preparation by the board and by my predecessor, Dr. Stevens, and had a great team. And then COVID-19, and boom, things got turned upside down like they have been for Berrien Center, I'm sure, as well.
Yeah. So tell us about your kind of the narrative that you've been a part of. I mean, I'm assuming somewhere in January, February, kind of became aware that there was this, an outbreak that was then an epidemic and then a pandemic, and now it's all here. How has that impacted your work? Both like organizationally, internally, but then also as you face out toward all these Christian healthcare professionals, what does it mean in that context to you?
Well, CMDA is huge. We have over 45 conferences a year. So you can imagine, including our national convention, which was just supposed to be about 10 days ago, all of that had to be set aside. I did get in a lot of travel. Going 9,000 miles to Kenya back and forth over 20 years, going across the U.S. is nothing. So there are a lot of stars on the map where I've been up until about March 6th. And I really enjoy that, Dan. I really enjoy engaging with 90 some community groups and 324 campus groups that we have. And all those groups, there's an element of discipleship, transformation goals there. So what's amazing is the adaptation, what we were saying just a few minutes ago before we started recording, the adaptation that some really innovative leaders that I have in our campus and community ministries, which is the core of what we do, graduate ministries, a lot of Zoom meetings, a lot of Bible studies and prayer times. We had a National Day of Prayer on April 8th that we had on Facebook, attended by 150 to 200 healthcare professionals. And one of my senior staff who's been around for 20 years said, that was the best single day event CMDA has ever had. I mean, just the amount of participation, the quality of the presentations, and then the whole, I'm sure what happens when you do your church now, all this chat that's occurring,
Yeah, that's the fun part of all this.
Yeah. And it's like you have permission to talk in church,
Right.
So we did that too. We've had couple of big meetings and, some financial losses that occurred with those. And we're just trusting God to help us through all that, just as Berrien Center is, just as you are and your pastoral staff. We put together every year around April, May, the largest gathering of medical missionaries that ever occurs in the world. And we don't talk a lot about where that occurs because of some security issues, but this year there are over 900 missionaries, medical missionaries and their families registered, and then it all fell through at the end of March, 1st of April. And that was a disappointment to many, including me, because I was going to attend. That was going to be in Greece. But we're trusting that some continuing education that was to occur is still going to be done online. And we're still sending out all kinds of encouragement and praying for we have over 1,000, maybe almost 1,500 actually, partners. We're not a sending agency, but we are a supporting agency for healthcare missions. And over my years in Kenya, Pastor, I was supported in so many ways by CMDA. And so when I was asked to come here, it was just an amazing blessing and privilege.
Yeah. Okay. Well, let me ask you a couple of questions about COVID-19. As far as how it's impacting healthcare workers from your perspective, and realize you're looking at this internationally. So maybe we'll start domestically and just say, if you're if you are a Christian doctor practicing in the US today, like how should we be praying for those doctors, and what do you see as the struggles that they've got, today, and then maybe going forward from here? Just, you want to speak into that a little bit, and then after that I'll ask you again, like about on the international front and missions medicine, how we should be praying for that.
Well, I just had a Zoom call only 2 hours ago with doctors from New York and the West Coast, as well as our member well-being team. We actually have a ministry called the Center for Well-Being for healthcare professionals. I'm sure that many of the people there in Center watched the news and saw that a Christian doctor in New York City took her life recently. She committed suicide. Beautiful, bright, no history of mental illness. As a missionary doc, and some of you have some missionaries in your church who are medical missionaries, you get used to people, a lot of death, but American doctors are not used to death. And so this Dr. Breen was the head of an emergency room in New York City, and unfortunately, very sad, took her life. And so that kind of was just in the last 7 days, a wake-up call for us. We were already trying to have weekly meetings online for docs to come into a safe place and talk about the challenges. It's a real paradox, Dan, because I've got most of our members, some of whom are even out of work because they do more elective stuff.
Right.
I know that Dave Cook and I have had this conversation in the last 14 days, actually, where your eye surgeons are frustrated. I have a good friend who's an orthopedic surgeon, very frustrated. So they're twiddling their thumbs. But then on the other hand, you got a number of docs in big cities who are overwhelmed. And I've seen the narratives. I've talked to the docs who are there. I actually do a weekly podcast now since January called CMDA Matters.
Okay.
And I've interviewed some folks from New York, a couple of our members on Staten Island, and they've just got they have, representing Jesus, not closed their doors. A lot of clinics have for fear or just resources, and they've kept their door open, and a lighthouse.
Yeah.
So on ground zero, lots of fear, angst. We have a tight-knit group in New York City, our CMDA chapter there, who are leaders. We've been partnering with Samaritan's Purse. It's been there are all kinds of silver linings. It's not just innovation and technology, but, locking arms with other organizations like Franklin Graham and Samaritan's Purse in Central Park. And our global health trips, they've shut down. 50 teams a year. We've had to shut that down because of travel, but we can come alongside and help an organization domestically, like Samaritan's Purse, with volunteers.
Yeah. Okay. And you mentioned that podcast. Can you say the name of that again?
It's called CMDA Matters, Matters, and it's a weekly podcast. I have different guests there each week. Just did an interview this morning, but Dr. David and Janet Kim is a recent interview that I did. The two docs, both are family docs on Staten Island.
Okay. Oh, interesting. Thanks for that. Okay, and then on the international front, for medical missions, I know that, it's already, like before COVID-19, there were already ongoing scenarios of desperation and lack of resources and challenges. What are you seeing now on that front, and how could we pray for hospitals, medical missionaries on the field?
Well, I'm actually on the board still of the Friends of Tenwek organization, where I was for 20 years. And so we've been in close communication with Tenwek, where I was, and then also getting lots of communication from other places around the globe. In some ways, I know, like in Kenya, they've only had 300 and some odd cases that the Ministry of Health in Kenya have reported, and yet their measures, social distancing and all these public health measures, are in place. It's tough, and they don't have visiting staff anymore. They've shut down elective surgery, much like we have, and it's like they're in a pause.
Yeah.
They're waiting for the tsunami of cases and praying that it doesn't come. And infrastructure at Tenwek's pretty good. A lot of places, not even oxygen available. So some missionaries had to make some hard calls in the last 6 weeks to decide, do I stay put knowing that the care I'm going to have available if I or my family member or my colleagues get COVID-19, it's going to be tough to find a ventilator.
Yeah.
Um, and so a few decided for various reasons, many good reasons, to come home, but many have stayed put, stayed the course. And so just pray for wisdom and good stewardship. Missionaries tend to put a lot of pressure that they've got to take the risk and they've got to be there. And sometimes spouses or families don't understand that. So pray for them for wisdom and then God's protection, of course. Psalm 91, that he'll rescue and protect them and honor them.
Yeah, absolutely. So we're going to come back with a part 2 of this video time and talk a little bit about the future and how you see it. But just on behalf of BCBC, I wanted to thank you for your ongoing service here, and thanks for letting us be a part of the story as a supporter of yours. It's really neat to see how God is using you and the organization to encourage so many. One question I had is if a doctor is watching this video, or someone is friends with a medical professional or something, and they're not connected to you, how should they connect to maybe get access to some of the resources or encouragement that you have?
We have, and thank you for asking, Dan. We have an incredible digital media team, and we have a phenomenal website, cmda.org. Lots of resources. We have public policy, bioethical position statements, conferences. We are just tomorrow pushing the button on a brand new online learning center, bringing Christian worldview, continuing education for all kinds, medical, dental, physician assistants, nurse practitioners. We're going to be focused on, so for those of you who have physicians or dentists in your network or PAs, going to be focused on bioethics from a Christian worldview online, well-being, and of course right now with COVID-19, well-being is a big deal, but well-being for healthcare professionals. And then finally, integration of faith in healthcare, living out your faith. So those are going to be some of those resources starting tomorrow on our CMDA Learning Center. And then ways that people can connect with various, we have 12 sections, specialty sections within CMDA, but our website kind of speaks for itself. Blogs, communicate. We actually have a COVID-19 resource page with all kinds of stuff for healthcare professionals.
That's great. Well, thank you so much for joining us today, Mike. We really appreciate it. So.
My honor and privilege. Thank you. I was going to say CMDA family, BCBC family.
Gotta keep all the alphabet soup of things straight, right?
Yeah, exactly. Thank you.
Great.